Does your child have a fever? Are you worried what you should do? When should you let your pediatrician know about it? When to bring your child to the ER? What to give to your baby? Well, welcome to today's Ask Me Anything episode, where I answer your most common questions. Before anything else, I'm Dr. Kristine Alba Kiat. I'm a board certified pediatrician, and my mission is to empower you moms and dads so you can raise happy and healthy kids. In today's Ask Me Anything episode, we will talk about fever in children. Now let's get started. All right, first question. What is considered a fever in children? Well, rectal temperature of a child that is 38 degrees Celsius or 100.4 Fahrenheit is considered fever in kids. What causes fever in children? The most common cause of fever are viral or bacterial infections. Other causes of fever may be after immunizations, or teething episodes can cause fever, although there are low-grade fever. And also, some environmental factors can cause fever in kids. Then, when should I be concerned about my child's fever? Yes, this is an important question, and you should take note of these. For any baby who is 3 months or less, any episode of fever you should immediately worry about, and you should let your pediatrician know about it. For an older child, you should worry if your child has a high fever of 40 degrees Celsius or 104 Fahrenheit. And other thing that you should worry about is if your child's fever is accompanied by seizure. You should also worry if your child's fever persists or has been gone for a couple of days and it still has not lice. That that time you should let your pediatrician know about it. All right, for the next question, how should I measure my child's temperature? All right, the rectal temperature is considered to be the most accurate way of getting your child's temperature. So you use a rectal thermometer and you put the thermometer on your child's rectum. There are other ways and easier ways to get your child's temperature as well. And this is oral, so by the mouth. You can also use an axillary thermometer, so under the armpit, or you can use tympanic or through the ears. All right. Should I treat every fever with medication? This is not necessary. It is more important that you look at your child. You give fever medicine to make your child more comfortable and also to prevent dehydration. If you think your child has a fever but is active and doing okay, it is not necessary that you should treat it. But of course, you can give fever medicine. All right, what over-the-counter medications are safe for my child's fever? Well, it depends on your child's age. For a newborn baby and up to any age, it is safe to give acetaminophen, or in the Philippines, the counterpart is paracetamol. You can give it to reduce baby's fever. The dosage you can follow based on the child's age and weight, and there are always instructions on the box. To give a more accurate dose, you can ask your pediatrician about it. Another fever medicine that you can give for your child is ibuprofen, but take note, it is only given for babies who are 6 months and older. It is not safe for much younger kids. You can also follow the dosing on the label on the box, or you can ask your pediatrician about it. When should I seek med attention for my child's fever? Well, again, this is an important question. You should seek attention and ask your doctor if your baby is less than 3 months and has a fever. if your child has a high fever, so it is 40 degrees Celsius or 104 Fahrenheit or higher. And also, you should worry if your child has been having a fever for a couple of days. And also, do watch out if your child is weak looking or lethargic, is having the chills, or has seizure episode. Next question. Can febrile seizures occur with a fever in children? Yes, febrile seizures can occur in children, especially in young kids. It is important that you should bring the child to the ER when this happens, or you should let your pediatrician know about it. In general, febrile seizures are brief and have no long term effects on the child. There is usually a family history of febrile seizures, and it is best that when your child has a seizure with a fever, that your doctor should evaluate your child. Next question. Should I alternate between acetaminophen or paracetamol and ibuprofen for fever? Well, with this question, it is important that you discuss it with your pediatrician. As long as you follow the dosing guidelines, and it is also important that you take note of your child's age. Any age you can give acetaminophen or paracetamol, but ibuprofen is only given for babies who are 6 months and older. Whereas to alternate between the two, it is okay, but I want you to discuss it with your doctor. How can I keep my child comfortable during a fever? So, it is important that you keep your child hydrated, give plenty of liquids, and also watch out if your child now has signs of dehydration. And signs of dehydration in children include being weak looking or lethargic, having dry mouth or lips, having sunken eyes, having fewer wet diapers. If your child has fever with signs of dehydration, it is important that you talk to your pediatrician about it. Also, you can help your child by making the environment comfortable. So put your child in a cool room. And if your child is having some chills, then you can put a blanket on your child. You can also use fever reducing medications, as we have previously discussed. Talk to your pediatrician about it. All right, we have answered the 10 most common questions. Remember, these are general information, and it's always best that to seek consult from your pediatrician. If you liked today's episode, watch my next video where I teach you about other child health problems.